My name is Allie Lyons, and I'm going to be your speech language pathologist today. So I looked through your case history, and I've noticed that you live independently, and you had a CVA 3 months ago, and I see that you're having some difficulty finding words while you're communicating, and you've developed some form of stuttering after having this CVA. So I just want to make sure that you're comfortable with everything. I also see that you also took some initiative to look for possible techniques, which is awesome. So I will try my best to give you some techniques that will hopefully and possibly benefit you throughout this therapy time. So I want to know, what are your possible goals, or what do you want to see improve or anything during this time?
I feel like I've made progress in a lot of my different areas, but not in stuttering at all.
Okay.
I've been looking at techniques online, and it's not getting any better.
Okay. Thank you for telling me that. So this is just what I feel might be beneficial. Possibly we can do what is called is an iceberg scenario. And with this scenario, you will see you will notice and identify any physical things that you see with your stuttering and how you're feeling emotionally. And this can help me and you judge how we can help you throughout this time. So what it is, I have a set of papers, and it has an iceberg on it. And at the top, you will write what you physically see with your stuttering. Like, you may notice that if you block or you have prolongations, that you notice certain things that you're doing physically with your face or with your body language in general. And then under the iceberg, you will just identify some things, how you're feeling personally about it. And it's okay. It's okay that you stutter. I'm here to help you throughout this time to feel comfortable with it. And so, do you have any possible questions or concerns for me right now?
What will help it go away?
So there's not necessarily anything for it to help it go away. But what we can do is we can, I can teach you certain techniques that can help make it easier for you. So that is what I have.
Okay.
That's basically it. So we can just judge it from the first activity, and then we can go on from there, if that's okay with you. Okay.
So you want me to tell you things about my stuttering?
Yes. I would like you to tell me things about your stuttering, things that you're feeling, things that you're seeing. And I would also like to know how you're coping, living with independently, how that looks for you. I know that can be kind of hard after you've had that CVA, and then now you're dealing with certain.
Hi, Allie. My name is Sarah Schrader. I'm going to be the speech language pathologist working with you today and in the future. Can you tell me why you're here? Why did you come to see me?
So I had been wanting to find a job. I have been dealing with a lot of complications in the family. I got some speeding tickets. So I really need to find a job to help pay for those. So yeah.
Okay. So I read from your case history, you've been stuttering for quite a while. Is that right?
Yes.
Okay. All right. So you want to work on your stutter, and particularly so you can get a job in order to pay off your speeding tickets. That sounds like a good idea.
Yes, it's very unfortunate, but yeah.
Okay. So, tell me about getting a job. What are your feelings towards interviewing and working with other people?
I get really nervous, especially talking in front of people, because the stuttering is so bad. So I was really hoping that I can make it easier for me.
Yeah, absolutely. We can definitely work on interviewing skills, introducing yourself, and then also just communicating with people in the workplace. What kind of jobs are you looking for?
Right now I'm just looking for possibly restaurant, fast food,
Okay.
just something easy.
Okay, got it.
Get
Okay, so based on what you've told me, the things you want to work on, again, I think we can work on introducing yourself to other people, maybe work on disclosing your stutter, so letting other people know that you stutter. How do you approach that? Interviewing skills, and then just communicating with people, coworkers in general. So first, disclosing your stuttering. I think this would benefit you and your overall experience, because I want you to be confident in your ability and your speech and even in your stuttering. And then next, we will be targeting some stuttering modification strategies. So what these are, they help you to identify what's going on in your stutter. So I'll have you locate where in the speech mechanism you feel the stutter, and then that way you'll have more control of the stutter, okay?
Okay.
And then there are also fluency modification techniques. And what these are, they're techniques that actually alter the way you're speaking. So the rate, the force, the tension. And again, this helps you take more control of your stutter and be more aware. And so we'll integrate all of these strategies into situations you may encounter, like in the interview and in the workplace. So I want to practice some of these, okay, so you know what they're all about. So first we'll do a stuttering modification, okay? So this is voluntary stuttering, and it's exactly what it sounds like. I'm going to have you stutter on purpose.
Okay.
It may sound counterintuitive at first, but it helps you bridge the gap, or more so create a bridge instead of a wall. So, I want you to be comfortable with your stutter, and I want you to have control of it. So I want you to do what I do, okay, and I'm going to voluntarily study. So, hi, my name is Allie. Now you try.
Hi, my name is Allie.
Good. Okay, we're going to try it one more time, and I want you to stutter on the hi. So that seems like it was the most difficult word for you to say, so I want you to stutter and repeat the entire word 3 times, okay? So, hi, my name is Allie.
Hi, my name is Allie.
Good. How did that feel?
There was some tension.
Yeah, okay. So we'll use that strategy and we'll work on it. And then next we will try a stuttering modification called easy onset. So again, this is kind of what it sounds like. You're gonna start the word easy, okay? So this is going to prevent the stuttering from happening. And I want you to use it on words you think you're going to stutter. So any words that you know what you want to say and you're like, dang, I'm trying to avoid this word. I want you to use this technique on that word, okay? So you're going to just start off slowly and easily with not, I don't want a lot of tension, okay? But this isn't saying the word in slow motion. So for example, my name is Allie. Okay, you try.
My name is
Okay. I want you to try one more time, and I think you're integrating both strategies. I don't want you to purposely stutter. I just want it to be smooth airflow. Okay, so Allie. Good. All right. I'm glad you're able to do these. I think these will benefit you and will able to get you towards your interview. Okay. So these some things we'll be working on next week. Okay.
Okay. Thank you.
Great work.
Questions. I know it looks like you have been to speech therapists before, and I kind of wanted to ask about your experiences in therapy and kind of your feelings towards therapy right now.
I went to therapy before. They didn't really seem to help me a lot. So I'm trying one more time. I hope this time will be better. I stutter a lot during stressful situations, like in class, or anytime I'm speaking in front of anybody.
Do you have goals to continue working on modifying your stuttering? Or I know that you have some job interviews coming up. Can you tell me a little bit?
I'm applying for an internship. Well, I actually got an interview for an internship. It's for a job I want in the future. So I want to work on interview skills and how to talk during the interview.
Yeah, absolutely. So I want to talk to you about a couple things that we could work on together. One of them that I think could be beneficial for you, for me to support you in disclosing your stuttering to people around you, people you're interacting with.
Yeah. I hate talking to people about my stutter because I think it defines me.
Mm-hmm. I think that's a common feeling that a lot of people who stutter have, and it's hard when you get listener reactions and reactions from people when they're communicating with you, kind of in reaction to your stuttering. And I think something that could be beneficial for you, if you're open to it, would be to talk to the people that you're talking with about your stutter, because it gets it in the open. It can ease listener reactions. You can personalize it a little bit as well, make it something suitable to your personality, something to kind of ease it off a little bit. Would you be open to it all?
I know that would help me. I hate it, but I know it would help me.
Mm-hmm.
So that is something I want to work on.
Yeah, and what we can do too is practice doing that in sessions and come up with a couple of different ways that you maybe want to tell different people in your life that you may come across, so that it can kind of support you in doing this when you're out in the community.
That would be great. My last therapist just told me to start disclosing, but we never did it in therapy. So I think it would be helpful to practice with you.
Yeah, that's definitely something that we can work on in these sessions. Also, in addition to that, I want to maybe work on helping you explore the way that you talk and the way that you stutter, by understanding the speech system and how we talk and how our lungs and our vocal cords and all of that support our speech. Is that something you have learned about with past therapists?
Yeah, we talk about muscle tension and changing the tension, which is something that has helped sometimes. But yeah, I think it would be good to know what's going on.
Yeah, and that's something we can do. Talk to you about how your lungs support that airflow, how your vocal folds get involved, and then all your articulators, so your tongue, your jaw, your lips, help to shape the sound, and then helping you identify where the sound is that you're maybe getting stuck when you're speaking.
Okay.
Okay. Well, I look forward to future sessions with you and working on all of this.
You seem like the best therapist ever.